good evening. Today, the COVID Cabinet Committee has approved a number of measures that constitute a careful and prudent plan to remove Alberta's public health restrictions and move on from a widespread pandemic response to get our lives back to normal. Before sharing this plan with you, I'd like to address some of the considerations that informed our decision today. First, it is clear that we passed the peak of Omicron infections about 3 weeks ago and are now seeing the result as COVID-related hospital admissions are declining. This is good news and broadly reflects the experience of other jurisdictions around the world when it comes to the Omicron variant. That's why countries like England, Scotland, Ireland, Denmark, Sweden, Norway, South Africa, Finland, and many others have lifted all or almost all public health restrictions in recent weeks. It's also why a growing number of states across the United States have also announced the lifting of most public health measures, including mask mandates, such as the states of California, Connecticut, Delaware, and New Jersey just in recent days. I note that the provinces of Saskatchewan and Quebec have followed suit with their own announcements earlier today. Alberta's active cases and rolling 7-day average of new cases has dropped steadily across the province from about 7,000 a day to approximately 2,000 a day, with total active cases falling from 55,000 to about 30,000 now. The positivity rate, that's the percentage of PCR tests that come back positive, has also continued to decline. And leading measures like wastewater surveillance has shown a general decrease in most regions of the province. And as I said, we see new COVID hospital admissions coming down, another important leading indicator. It's also important to note that because Omicron is more transmissible than previous variants of COVID, it is infecting more hospital patients who don't actually have severe COVID symptoms. So about 40% of patients in the hospitals who have tested positive for COVID are not actually being treated for COVID. They are what we call incidental cases. Now, they can add some additional pressure to the system, but to put this in context, with about 1,500 overall non-ICU COVID patients, actually only about 900 of them are being treated for COVID or COVID as a secondary condition. It has also and always been the government's approach to keep public health measures in place only so long as they are absolutely necessary to protect public health and our healthcare system. Throughout the pandemic, Alberta's policy response has always sought to avoid overwhelming our health system while minimizing the damaging impact of restrictions on the broader health of our society. Earlier in the pandemic, when vaccine uptake was much lower, other treatments weren't available, and testing was much harder to come by, so more drastic government interventions were necessary to keep people safe. And let me just pause to address what happened in Alberta during the Delta wave in August and September. The reality is that we simply didn't have high enough vaccine rates, nor did our neighbors in Saskatchewan. That's why we were hit harder. But all of that has changed. Now, 9 out of 10 Albertans over the age of 12 have some level of vaccine protection. Antiviral drug treatments to prevent severe disease and hospitalizations are now available, and more will come on stream throughout the year ahead. In other words, with what we know now about the virus and the tools we have to fight it, the threat of COVID-19 to public health is no longer outweighs the hugely damaging impact of health restrictions on our society, on people's mental health, on their emotional well-being, on our broader social health. So now is the time to begin learning to live with COVID. These restrictions have led to terrible division, even amongst families and friends, and inflamed sometimes tensions in our communities and neighborhoods. They've disrupted and even destroyed so many livelihoods. We will never know, we'll never be able to do a full accounting of the extent of the pain and hardship that restrictions have caused. But we do know some things. We know we have seen in Alberta and across the developed world a significant increase in mental and emotional health challenges amongst children and adolescents, for example. We have seen an increase in domestic violence. We have seen the failure of many businesses, and of course, at the beginning of the pandemic, record high unemployment. And at a time when the world should be wide open and full of possibility and hopefulness, COVID and the restrictions associated with it have robbed thousands of young children with the simple joys of just being a kid. I was speaking to a young father the other day who told me that his 10-year-old daughter had spent 20% of her life under COVID health restrictions. We cannot remain at a heightened state of emergency forever. We have to begin to heal. And so Alberta will move on, but we'll do so carefully. We'll do so prudently. We will do so only if it does not threaten the capacity of our healthcare system. So our plan will involve 3 steps, starting with easing restrictions on activities and situations that have been shown to be lower risk throughout the pandemic. The first starts with children and youth. Step 1 will remove almost all restrictions affecting children, including removing the mask mandate for all K-12 students effective this weekend. Outside of the school setting, kids 12 and under will now be exempt from the general mask mandate that will continue to apply in indoor settings for approximately 3 weeks to come. As I have long said, kids have been subjected to a heavy and I think unfair burden throughout the pandemic. And it is given the very low threat that COVID-19 poses to the health of children, it is no longer justifiable after 2 long years to continue to disrupt and restrict the normal lives of kids. It is time to let kids be kids. And I am determined to ensure that should we ever have to come back to any kind of measures in the future, God forbid, that we will not affect the wellness, the freedom, and the normal lives of kids. Step 1 will also end the Restriction Exemption Program in its entirety, effective midnight tonight. This is, I wanted to say this about the Restriction Exemption Program. We brought this in September when our healthcare capacity was under very severe stress, particularly in intensive care. And at the time, we saw that 90% of our new ICU admissions were amongst unvaccinated people, and the province was generally under-vaccinated relative to the rest of Canada. We simply had to do something urgent to prevent a catastrophe in intensive care and in our hospitals generally. And we had to do something to get our vaccine rates up. And so we chose a measure that avoided shutting down businesses and places of worship, but allowed us to reduce transmission while also seeing a significant increase in vaccinations. We went from about 75% vaccination rate to now 90% on first dose, and we went from 68% to 87% second dose coverage. That has made a huge difference. It has saved many lives. And at the same time, we have seen a change in transmissibility. The reality is that with the high level of infectiousness of the Omicron variant, plus the waning protection from infection of a second dose, most Albertans got their second dose 8, 9, or 10 months ago, we have seen that that vaccinated individuals are still at a high risk of Omicron of infection, not of severe outcomes, not of severe disease, but of infection. And so the point is simply this, that the Restriction Exemption Program has served its useful purpose. It's done its job. It is no longer leading to higher vaccination rates. In fact, we have seen our vaccination rates effectively frozen since early December. And so our approach to COVID must change as the disease changes. And I believe that's exactly why the Chief Medical Officer for Canada, Dr. Tam, recommended earlier this week that provinces re-examine programs like their proof of vaccination programs. That's exactly what we're doing with this decision. Finally, step one will remove capacity limits for all except large capacity venues of over 500 people. Minister Copping will provide further details on these measures. Now, following these phase one measures, we will take 3 weeks to carefully monitor trends with a focus on hospitalizations. If and only if we continue to see a downward trend in hospitalizations, we will then proceed to phase two. Our current target date for phase two is March the 1st, at which point we plan to lift most remaining restrictions, including the indoor mask mandate, the requirement to work from home, and remaining capacity limits. Following this stage, we will take more time to monitor trends, again with a focus on whether pressure on our hospital system is manageable. When it is safe to do so, we would then proceed to stage three, which would be to eliminate all remaining public health measures at that point. So let me add an important caveat. If the current trends reverse themselves and if we see a significant and sustained increase in pressure on our hospitals, we may have to pause some of these measures. But we are determined to get our life back to normal, doing so in a way that ensures that a hospital bed is there for everyone who needs one. And that is why a big part of the upcoming provincial budget later this month will be about increasing the capacity of Alberta's healthcare system. Because despite the sometimes heroic efforts of our fantastic frontline healthcare professionals over the past 2 tough years, the same 2 years have spotlighted serious shortcomings in the Canadian healthcare system, which we simply must address, beginning with the federal government paying for its share of an increasingly costly and complex modern healthcare system with an aging population. So I very much hope that today's long-awaited optimism this announcement rather gives a sense of optimism and hope to Albertans. I know that some will say this is too much change and that we are moving too fast. But please keep in mind that we have the benefit of a few weeks being behind a few weeks of other jurisdictions, such as the United Kingdom, and we can watch what happens as they return to a regular way of life. For example, in Britain, most restrictions have been dropped as the Omicron wave has subsided, and aside from masking in high-risk settings such as acute care and mandatory isolation for people with COVID, there are no other countrywide mandates in Britain. Cases and hospitalizations for COVID are continuing to drop there, and in all the other countries I mentioned that have lifted measures with the exception of Denmark. While we are closely monitoring what other places are doing, and have no doubt, please do have no doubt, that our plan is focused on the data here in Alberta. It ensures that we will remain sure-footed, ever aware of what is happening in our own healthcare system and maintaining protections for those most at risk until the very end of this plan for getting back to normal. So we are moving carefully, we are moving with confidence. While we are working towards an end to restrictive measures and the damage that they impose, I want to be clear. None of this is an end to COVID-19. New variants will arrive, and we will still see times when cases are higher in the province. We will likely also see times when there is additional pressure on the hospitals. But restrictions, mandates, and those kinds of interventions will not and must not become a permanent feature of our lives. With widespread uptake of the vaccines, as I say, close to 87% fully vaccinated with 2 doses, and nearly 1.5 million Albertans with having received their 3rd shot, we are well positioned to live with this virus as we do with many other infectious diseases. The vaccines are doing what we've always said they would do, to protect us from severe illness and outcomes. The numbers don't lie. Over the past 3 months, the rate of COVID-19 deaths of healthy but unvaccinated individuals in Alberta is over 7 times more than those who have been fully vaccinated. When this previously healthy but unvaccinated group is compared to those who have been fully vaccinated and boosted with their 3rd shot, the comparison widens. the rate of unvaccinated deaths is approximately 17 times that of people who have been fully vaccinated and received a third shot. We have been strongly encouraging Albertans to get vaccinated because we know it works, and we want to keep you and those around you safe. So now that the overwhelming majority of Albertans are protected, we are confident that we can begin to ease restrictions while preventing undue strain on our healthcare system. And we are not returning to normal all at once. So please continue to exercise good judgment and make smart decisions, decisions that make sense for you and your family. Our acute care system is still under real stress, and we may still see waves of COVID-19 come and go, as I've said, in the months ahead. But we will always need to protect the most vulnerable and may need to adjust as we start this transition. The virus has certainly left all of us bruised, but we are not broken. We Albertans are never broken. We are always resilient. It is time to call on that resilience as we move in the path to recovery. It is time to remove these restrictive and damaging health measures. It's time for us to learn to live with COVID as best we can. Thank you, and I'll now invite Minister Copping to provide more details.
Thank you, Premier, and good afternoon, everyone. As you just heard, we have been hard at work developing a plan for easing public health measures. We are shifting our approach to managing COVID. It's an approach where we all learn to live with COVID, which we can safely do with our high rates of vaccinations, the wide availability of booster shots, and continued protections for the vulnerable. This plan ensures that our healthcare system will be there for Albertans in their time of need. As I've said before, not only is it a question of actual beds, but the expertise needed to look after patients in those beds. Our healthcare workers have borne the brunt of this pandemic. They have carried on, and they have cared for us. We cannot and we must not return to the same high levels of strain it has experienced over the past 2 years. So to all healthcare workers and doctors and volunteers caring for Albertans, I want to say once again, thank you. This plan we're outlining today ensures that we will not remove the public health measures at the expense of our healthcare system. The vast majority of Albertans have chosen vaccination and are now fully protected. Just as it was a key component of our Restrictions Exemption Program, it's now also a major factor that allows the easing of those restrictions. Now that the vast majority of eligible Albertans are fully vaccinated and boosters continue to work their way into more arms every day, it's clear that our province is well protected against severe outcomes such as hospitalization. We also have treatment options such as antivirals that are now available to us. We considered all of these things when developing our plan for easing measures, and will continue to consider a myriad of factors as this three-step plan moves forward. As Premier mentioned, I will now provide further details on the plan. It is a conditions-based approach, which requires us specifically to look at the numbers of new patients admitted to hospital due to COVID-19 over a sustained period of time. Given the current trend in hospitalizations and transmission, we will move into step 1 at midnight tonight. Effective at midnight, the Restriction Exemption Program and all its requirements will come to an end. The exception will be for entertainment venues. That means that measures on the maximum number of people per table at restaurants, liquor service restrictions, closing times, and interactive activities closures will remain in force. But measures limiting food and beverages while seated at entertainment venues will be removed. For facilities that are not currently in the REP, capacity limits will be removed, except for the following. All facilities with capacity of 500 to 1,000, which will be limited to a capacity of 500, and all facilities with a capacity of more than 1,000 will be limited to 50% capacity. As well, Effective February 13th at 11:59 p.m., we are removing all mandatory masking requirements for children under 12, and mandatory masking in schools will be removed for all children and youth. This change is delayed in order to give schools and parents time to adjust. If COVID hospitalizations continue to trend downwards, then, as indicated by the Premier, we will move to Step 2, effective 11:59 p.m. on February 28th, 2022. The following measures will be removed: remaining school requirements, requirements for screening prior to youth activities, limits on gatherings, general masking requirements, mandatory work from home requirements, capacity limits removed for large venues and entertainment facilities, and restrictions on closing times and interactive activities in entertainment venues. We will move to Step 3 at a later date, contingent on hospitalizations continuing to trend downward. And this will include COVID-specific continuing care measures being removed and mandatory isolation requirements being removed and becoming a recommendation only. This represents a careful and prudent approach to removing public health measures in Alberta. Vaccination will continue to be vital to minimizing the risk of COVID, and we will keep working to get as many Albertans of all ages vaccinated with all the doses they are eligible for, including booster doses. I'm happy to announce today that based on the recommendations of the National and Alberta Advisory Councils on Immunization, we are expanding the eligibility for vaccines for youth. Youth between the ages of 12 and 17 who have additional risk factors will be eligible for third doses as of Tuesday next week. We are also working towards offering boosters to children between the ages of 5 and 11 who have specific immunocompromising conditions, and we'll have more to say about that in the coming days. These vaccines are safe and will protect Albertans' children. I know it will be welcome news to these young Albertans and also to their parents. Bookings for 12 to 17-year-olds will be open next week, and more information will be shared in the coming days. Whether your child falls into these higher risk categories or is already eligible, I encourage all parents and guardians to get their children vaccinated. Currently, nearly half of all Alberta's children aged 11 and under are vaccinated with 1 dose, and 15% are fully protected with 2 doses. If you have been waiting, please don't delay any longer. Book your appointment today through the Alberta Vaccine Booking System online or through HealthLink at 811. This is true for all doses, not just for kids and for youth. So if you're not yet vaccinated or fully vaccinated, you can get your first, second, or third dose today through most pharmacies in Alberta. We are entering a period of transition between the pandemic and endemic stage. As indicated by the Premier, there will be periods of uncertainty. COVID-19 will be with us for a very long time, and we will see times when COVID-19 infections will be higher than normal. But please rest assured, we will continue to closely monitor the healthcare system, and we will take action when necessary to alleviate pressure in future waves or spikes. That is why we cannot suddenly drop all the healthy habits and knowledge about COVID-19 that we have developed over the past 2 years. Our way forward and its success depends on you. So I'd like to call on all Albertans to continue to follow the rules that are in place to protect our healthcare system and each other. And if you haven't done so already, get your vaccination. Thank you for doing your part. And now I'd like to invite Dr. Hinshaw to the podium for her update.
Thank you, Minister, and good afternoon, everyone. Over the last 24 hours, we have identified 1,667 new cases of COVID-19 and completed about 4,260 tests. Our positivity rate is about 36%. There are currently a total of 1,623 people with COVID-19 in hospital, including 129 in the ICU. Sadly, 13 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to the family and friends of these individuals, as well as anyone who has lost a loved one, no matter the cause. Alberta Education has confirmed that as of February 8th, 7 of the more than 2,500 schools in the province are in temporary at-home learning to address operational challenges. Fewer than 1/4% of schools are currently operating online. As the Minister said, we know that COVID is not going away. It will continue to be with us for months and years to come. Thankfully, we have vaccines that are very effective at reducing severe outcomes and new treatments available as an addition to help reduce risk. We also have healthy habits that will remain important. This includes being mindful of our physical proximity to others and keeping distance from those outside our household, practicing good hygiene habits, and staying home when we feel unwell. These simple steps remain important and can go a long way to helping us stay healthy and protecting those around us. There has never been one right path to deal with COVID, and that remains true now. Every path has advantages and disadvantages that must be carefully weighed. As the province moves to eventually treat COVID-19 more like other infectious diseases, it is essential that each of us continue to do our part to keep those around us healthy and safe. Even as the approach to COVID shifts in our province, there will continue to be measures in place to protect those most vulnerable to this virus, particularly those in continuing care, acute care, and other priority settings. For example, masking will remain mandatory in acute care and continuing care as an important risk reduction measure for the foreseeable future. So if you are seeking care or accompanying someone who is, you will need to wear a mask to protect yourself and those around you. I ask everyone to be respectful and patient with those around you as we all adjust in the weeks ahead. I also encourage Albertans to continue to assess their unique situation and make personal decisions about their health based on their own comfort levels and risk levels. We should all do what is best for us and our families, even if that is different from those around us. If others need a higher level of precaution than we are taking for ourselves, we need to be considerate of their needs. Thank you, and we're happy to take questions.
Thank you, Dr. Hinshaw. We'll move to the Q&A now. Just a reminder, you can direct your questions to the Premier, Minister Copping, or Dr. Hinshaw. I understand we have someone in person in Edmonton, so we'll start with them and go to the phones. Never mind. We'll start with, oh, we're good.
Kieran Levitt with the Toronto Star. Thanks for taking my question. This is for the Premier. Premier, we've got reports that your own MLAs have been negotiating or trying to negotiate with blockaders down at Coots. You're also facing criticism that a lot of the moves that you're making right now and the policy decisions are being driven more by pressure on your government from that blockade. How do you reconcile those two things? You've got MLAs who are talking with blockaders and perhaps negotiating with them, and critics who say that, especially the Restrictions Exemption Program being cancelled at this point, is due to pressure on you from that blockade. How do you reconcile those two things?
Well, they don't need to be reconciled because they're not true. First of all, Kieran, nobody on behalf of the government of Alberta has been negotiating with anybody engaged in illegal actions, and our Acting Solicitor General, Minister of Justice, Sonia Savage, has made it clear to all members of Government Caucus that they do not and cannot negotiate on behalf of the Government of Alberta. Now, having said that, there are Albertans involved in that protest who have MLAs, and I understand that they've been calling and contacting their MLAs and talking to them, and MLAs have responsibility to listen to their constituents. That is not negotiating, it is elected representatives listening to their constituents. With respect to the blockade, Minister Savage and the RCMP held a news conference to provide a situation update this afternoon. As I've said consistently, we welcome the freedom of people to protest lawfully and peacefully. But this is not a lawful protest. This and other road blockages constitute a safety hazard, a serious interference in the lives of others. It does economic damage, in this case particularly for ranchers, farmers, and agri-food producers. I would point out to those involved in the blockade, I think there are about 38 trucks I should say, semi-trucks at the Coots border crossing itself. But we have some 300,000 Albertans with trucking licenses and about 60,000 commercial trucks that are licensed for operation in Alberta. So something like 99.99% of truckers and trucks are not involved in that protest. And in fact, that blockade, all it does is inconvenience thousands of law-abiding truckers who are just trying to make a living, who now have to go to one of the three other ports of entry between Alberta and Montana. So we would ask those folks to stop the blockade. We expect the RCMP to enforce the law. They are responsible for the operational tactics and how that is done. We respect their delegated authority in that respect. In terms of the eliminating the restriction exemption program, as I pointed out, Karen, first of all, I think on December 28th, our COVID cabinet committee came to a unanimous view that we should lift the restriction exemption program as soon as it was feasible to do so, because the case for it was simply no longer as compelling as when it was introduced in September. The program is no longer serving a useful and compelling purpose. I could not stand in front of Albertans tonight and justify a continuation of a program that has done its job. The restriction exemption program helped to see vaccination rates go from, as I say, on the first dose from about 78% to 90%, on second dose from about 68% to 87%. But those vaccine rates have been frozen now since early mid-December. So we've seen virtually no movement on that front. And what we do see now is with the infectiousness of Omicron and with the waning protection of second doses from infection and mild disease, what we have seen is that the initial purpose of reducing transmission in high-risk discretionary social activities is no longer today what it was in September. So we have to follow the data and not just blindly ignore it. Finally, Kieran, if what we're doing here is somehow a response to protests, then why has England, Ireland, Denmark, Sweden, Finland, Norway, South Africa, now Saskatchewan, Quebec, done the same thing? Why are U.S. states that have had much harder lockdowns than Alberta over the past 2 years, like California, New Jersey, Connecticut, Delaware, and many others, why are they right now lifting all or most measures? None of that has to do anything with a few trucks parked at the Coots border crossing. All of it has to do with the fact that the disease is changing, and so the approach that we take to manage it should change as well.
And can you detail a little bit what this means for the program in the future? Is this program something that is completely off the table now in terms of, future iterations of the virus? Is it just on the shelf and something that you could quickly re-implement should there be a surge in infections and death and some of the horrible things that we saw during the Delta wave, or is this something that you will never bring back?
Yeah, I don't think you're either not listening to what I'm saying, Kieran, or you're not aware of the data. The data is this, that in Canada right now, unvaccinated people are almost as likely, vaccinated people are almost as likely as unvaccinated people to experience a breakthrough infection. Now, it is critical to add that the vaccines are hugely effective at preventing severe outcomes like hospitalization and death. And that's why we continue to implore the folks who have not yet been vaccinated to get that safe and effective protection. But a program originally designed to reduce transmission amongst unvaccinated people doesn't make sense in a context where we have such a high level of breakthrough infections. So this is the data, this is the reality, and this is why jurisdictions around the world are now rolling up their proof of vaccination programs. It is why Dr. Tam said that provinces should re-examine proof of vaccination programs. I think she said that on Saturday. So no, I don't think that this program can serve any useful purpose in controlling spread now or in the future, unless we were to redefine full vaccination as having had 3 shots, because we do know that that third shot, the booster shot, having been more recent and also probably inducing a stronger overall immune response, is still somewhat effective at preventing breakthrough infections. So the only way that a proof vaccination program would make any practical sense would be to, as I say, make a requirement that people get a third shot. We're only at 43% third shot coverage amongst the eligible population in Alberta. So that's 60% of the population that would not be eligible to participate in discretionary activities. And then what happens if we see 6 or 12 months from now waning protection from breakthrough infections from a third shot? Would we then modify the program to require that people have a 4th shot? I think it's quite likely that for the rest of our lives, we're probably going to need to take an annual COVID shot, much like the annual flu shot. Every year, as you know, there's a slightly modified flu vaccine that is made available, and that is quite possible for COVID. Are we then going to attach this? Is this going to become a permanent feature of our lives? I think that's completely implausible. So the Restriction Exemption Program has served its useful purpose. It's done its job. We thank everybody who's cooperated with it. We thank all of the businesses and organizations who have incurred a lot of costs and inconvenience to roll out the program. We will continue to make the QR code available to those who need to download it if they are going to other provinces which require a provincially issued proof of complete vaccination, or if they are getting on a flight and federal regulations require that they provide a provincially issued proof of vaccination. So we'll continue to provide that as a convenience, but again, at this point it serves no useful purpose, and I cannot see that changing.
Thank you, Premier. Operator, can you please put through our first caller?
Thank you. Kelly Kreiderman, Globe and Mail.
Hi there, Premier. If this decision is based completely on the data and what is happening, why end the program at midnight tonight in such dramatic fashion instead of giving restaurants and other public venues a chance to adapt to the new rules, as is the case for other parts of this plan?
Well, there are no new rules, and I think it would be a bit of a mug's game, Kelly, to say keep this going for a few days when we know that in many areas we're already having compliance problems. I think it would just invite very widespread non-compliance for no useful purpose. We are at a stage where it's clear our vaccine numbers on first and second dose are frozen. I mean, they go up by a few thousand a day, but there's been no meaningful increase now since well before Christmas. So the REP is no longer making any measurable difference on the vaccination rates. And as I've said, with the data about breakthrough infections, the idea of using a program like this to reduce transmission in discretionary activities is no longer relevant either. So we're just stating the obvious and acting on that. Maybe a different way of asking your question, Kelly, is why did it take us this long? The United Kingdom, I should say England, the English Public Health brought in their proof of vaccination program, I believe as they started to enter the Omicron wave in late November, early December. And then they announced that they were repealing it about 3 weeks ago in mid-January, once they were coming off the Omicron peak. They've continued to see cases decline. And those other countries I mentioned, which were hit early by Omicron, any one of those countries that had a proof of vaccination program, they've all repealed them as well. So I think per Dr. Tam's comments this past weekend, I think that is going to become the norm throughout the world.
And Kelly, do you have a follow-up?
Yes, but Alberta is the first province to make this move of completely getting rid of the proof of vaccine system. Does that give you some pride? Do you think that matches with public sentiment as we're seeing it right now in terms of people's patience for living with restrictions at this point in the pandemic?
Well, I'll say this, that it's not about pride, it's just about being practical and realistic. We think the program has served its useful purpose. It really did help us to prevent the worst possible outcomes from the Delta wave and from Omicron. It got our vaccine rates up. There's no doubt that that alone has saved perhaps hundreds of lives. So I'm not dismissing the utility, the necessity of the program when it was introduced. It was a difficult decision. As you know, in the spring of last year, every Canadian government, including Prime Minister Trudeau, were dismissing the idea of introducing proof of vaccination programs for all sorts of obvious reasons. But we all found ourselves in a situation as we moved into the Delta wave where we had to use every tool at our disposal. And for Alberta, at least, it was an alternative to widespread lockdowns and shutdowns of businesses and community organizations. So it was a tough and undoubtedly controversial decision, but it was a necessary one. But now, as I say, we have to read the writing on the wall. This is no longer serving a compelling public health purpose. And in terms of being the first, well, I guess Saskatchewan will follow us this coming weekend. So we're close to that, and I see that Quebec just announced today that they are lifting over the course of the next 3 or 4 weeks virtually all of their public health measures. So I think you'll see this become a fairly widespread trend quite quickly here.
Thank you, Premier.
Can I just say, you asked about public sentiment. I'm sorry, Justin. So I do think that we have seen in recent weeks a fairly significant shift in public tolerance of damaging health restrictions. And you know, those of us who are elected folks, it's our jobs to listen to people, and we hear from our constituents. We also see public opinion research, some done by our government, a lot of it done by media organizations, and it's all pointing in the same direction, which is that Canadians, certainly Albertans, are increasingly losing patience with 2 years of the disruption of their lives, and are asking leaders to find a way to move forward safely, but to get life back to normal. You know, there's a epidemiologist at Oxford University, Dr. Ali Raghib, who I follow, and he said, I think quite insightfully, that public health restrictions that are opposed by the majority of the population do not have a meaningful impact. This is a point I've tried to make consistently about the responsibility of our cabinet to make a difficult judgment call at each stage of COVID about the public's willingness to comply. And when we see that willingness break down, what's the point of measures if there's widespread non-compliance? It's not the primary reason we're doing this, but that is part of the context, and I think responsible leaders need to be mindful of that.
Thank you, Premier. Operator, can you please put through our next caller?
Thank you. Andrew Lawton, True North.
Good evening, Premier. For people that own businesses that are comfortable with requiring proof of vaccination, will they still have the right, in your view, under Alberta law, to impose a vaccine requirement for customers moving forward?
Yes, they'll have that right under law, and I guess I would just say that's a matter of the free market, Andrew. If a business chooses to have a policy of that nature, then that may appeal to a certain kind of customer, and it may turn away other kinds of customers. That's a commercial decision. At the end of the day, I would love it if we could move away from all of this and no longer have to produce the QR codes. That could get us past the problem you've raised. But the paradox or the problem is that we have a lot of Albertans who, especially during the cold winter here, love traveling and at the end of the summertime too. And as long as there is a federal requirement for provincially issued proof of vaccination, we have to offer that as a service. And I got to tell you, even then, even if we weren't issuing QR codes, I suppose a vendor could, going back to the pre-COVID days, you know, just like when you were visiting certain countries, they want to see if you've been vaccinated against the yellow fever, and you have to produce these slips that prove vaccination. So governments will always be issuing some kind of proof of vaccination. That's just part of our responsibility in the healthcare system, and how people use that is their choice.
Thank you. And Andrew, do you have a follow-up?
I do, thank you. You mentioned that it's just an inevitability that we'll see other variants, and obviously you've said your government will continue to monitor the hospital data. We've been down the road of reopening before when Alberta was open for summer, and obviously we didn't have the widespread vaccination protection that we have now. But what specifically would be that trigger point at which we'd have to look at some level of restrictions again? If there is the concession here that COVID is not over and that a variant that we might not know the scope of or the power of could come and hit us?
The truth is we simply don't know. If we take cues from history, from epidemiological history, we can, I think, reasonably hope that SARS-CoV-2, COVID-19, will go in a similar direction as the Spanish flu, which, as you know, took something like 50 million lives between 1918 and 1920, but then moved to endemicity, partly because there were new variants that may have been more transmissible, were less severe, and because of wider population protection, both from the immune response to prior infection as well as vaccines. So we have far more effective and widely available vaccines now than ever before. Coming out of Omicron, we also have far more people with antibodies acquired from prior infection. And so I think it's reasonable to hope that we won't get into a much worse situation, but we don't know that for sure. So we simply have to be prepared for what the future may come at us, what may come at us in the future, excuse me. Now, having said that, I think it is incumbent on governments of all stripes in all jurisdictions to do whatever they can to avoid relying on the blunt instrument of damaging restrictions as a primary response to potential future waves with more severe outcomes. And by that, I mean, in the Canadian context, we have to fix our healthcare system, first and foremost. It is outrageous that Canada's public healthcare system is in the top quartile of the OECD in terms of cost, but the bottom quartile of the OECD, the developed world, in terms of per capita beds, per capita physicians, surgical wait times, diagnostic wait times, et cetera. This is not the fault of our brilliant and, through COVID, often heroic frontline healthcare workers, nor is it because of a lack of money. We are, as I say, towards the top of the developed world when it comes to healthcare expenditures. But we have to face the fact that we have had too little capacity to address a situation like this. That is something that we will be addressing forthrightly in our forthcoming budget, and it's incumbent on the federal government to do so as well. Minister Copping and I will have a lot more to say about that. So healthcare capacity, first and foremost, and secondly, using everything that is being learned about COVID-19 to provide better and more widespread treatments. And I think we'll see that throughout the year with the completion of more successful trials on antivirals and other medications, which can act as an additional tool on top of vaccines to help us cope with any future waves that are more severe.
Thank you, Premier. Operator, can you please put through our next caller?
Chris Varco, Calgary Herald.
Hi, this is a question for the Premier. Premier, the Canadian Federation of Independent Business did a study that showed pretty much an even split between business owners on the usefulness and their support for the vaccine passport. What would you say to businesses if they want to continue to use the QR code or want to continue to require customers to be vaccinated?
Well, as I said, it's a free market. And if businesses, vendors choose to adopt their own policy and ask people to provide some proof of vaccination, as long as we're issuing those QR codes, I suppose they can do so. But to be frank, I do hope the federal government will, in the foreseeable future, end some of the public health theater that has informed, I believe, some of the travel restrictions. I spoke to this last Friday on the conference call for the Council of the Federation. And, you know, in a world where, in North America, for example, we know there are tens of millions of current active Omicron infections. So the notion that these restrictions can somehow reduce transmission is nonsensical in my view, increasingly nonsensical. But as long as the federal government keeps that requirement for federally regulated travel to require a provincially issued QR code, we will issue those codes for the convenience of Albertans. And if people choose to offer to show that proof of vaccination to a business, I guess that's their choice. They're welcome to do so.
And Chris, do you have a follow-up?
Yes, just a point of clarification and then a question. Can you be a little clearer on the restrictions on closing times and alcohol service and when those exactly will be removed? That's my clarification question. And then just in terms of the broader question of many business owners is, what is the province prepared to do to try and install confidence in consumers to get back out there?
So the restrictions on the operation of hospitality businesses, such as the 11 p.m. Limit on alcohol service, 12 p.m. closing time, a maximum of 10 people seated at one table, a prohibition on activities like, for example, billiards and darts. Those restrictions that were brought in December will continue until we come to phase 2 of this back to normal plan, which we hope will start on March the 1st. So this underscores that we are proceeding with caution. The good news for those operators is that the proof of vaccination program ends midnight tonight, but we will ask them to maintain those other measures in place until at least March the 1st. I know that you and another journalist have asked about businesses who want to keep this in place. I think it's important to understand very rarely do rural media get to ask or get in the queue or ask questions of these things for some reason. But I think it's important to recognize that in many areas of rural Alberta with lower levels of vaccination, the Restriction Exemption Program has been extremely tough on many of the hospitality businesses for a couple of reasons. One, in some cases, 30 or 40% of their local population are not vaccinated, so that is a huge blow to their consumer demand. And secondly, it's often created really tense situations with their community members. So this is something that I know small business owners in rural Alberta have been desperately hoping for. And I want to acknowledge MLAs from rural Alberta for being a very strong voice for their constituents in this regard.
Thank you, Premier. We have time for 3 more. Operator, can you please put through our next caller?
Rick Bell, Calgary Sun.
Good afternoon, Premier and Minister and Dr. Hinshaw. I'm not going to get rid of my vaccine passport yet, Premier, because we still have a vaccine passport bylaw in Calgary. and we still have we'll have a masking bylaw in Calgary. And I know you've answered this before, but it was an answer I don't think a lot of people really had a lot of confidence in, that you'll take a look at it and maybe sometime down the line, and maybe when the Ledge gets back in session, something will happen. What are you prepared to do now, whether it's talking to the mayors of the city? What are you actually planning to do to ensure that the over 2 million people that live in Calgary and Edmonton will be on the same page that you are on?
Well, Rick, we haven't made any decisions. I've indicated that's an issue we're going to look at closely. I've asked our ministers of municipal affairs, health, and justice and solicitor general to come forward with options and policy advice on this issue. In the past, we have tolerated certain municipal bylaws on public health matters. We've tried to be collaborative and respectful. And as you know, we do try to respect as much as we can the delegated powers of municipalities. But I'd really like to have a longer conversation with particularly the big city mayors who have spoken to this issue, because I'd like to know if it is their intention to create an entirely separate municipal public health policy that is different and apart from that of the province. I think that would be a serious problem. And so that's something that we will talk to them about. We'll be listening to Calgarians and Edmontonians on this issue. We haven't made any decisions, but I would just say this. I think turning a public health policy like this into some kind of a local political football is not helpful. It's not conducive to public confidence in the public health parameters, or in the clarity about what the rules are from one part of the province to another. And finally, you know, it's the province is responsible for administering the healthcare system, which has got to be the central focus of all of this. And I think perhaps we've been a little more sensitive than some of these voices in municipal government about the damaging effect of restrictions. We are responsible for balancing all of these different considerations. Happy to have a respectful discussion with the mayors and others about this, and to look more closely at the issue, but we're keeping our options open.
And Rick, do you have a follow-up?
Yes. Well, at least now I know that everybody will be writing that we still have vaccine passports in Calgary and Edmonton tomorrow morning. A lot of, public opinion you talked about already, and I'm going to concentrate on the opinion of your MLAs, opinion of a lot of people who self-identify as small C conservatives. And do you think that what you have outlined today will help you keep your job on April 9th? Because there was a lot of pushback or push forward to get a lifting of restriction plan in place. So do you think this will actually help you win back the hearts and minds of small C conservatives and even people in your caucus?
Rick, this is nothing. Today's announcement is about a careful plan to move forward to get our lives back to normal while ensuring that we protect the healthcare system. Our goal from day one on COVID has been to protect the hospitals from being overwhelmed while limiting the damaging effect of restrictions. Obviously, that difficult balancing act has upset some people from time to time at both ends of the spectrum. I think that this government has been more widely criticized from those who believe that we have been too reluctant to resort to damaging restrictions than it has been criticized by people who don't like restrictions. So we have been trying our level best to have a balanced approach. And I think Alberta's done pretty well on that account. I would point out, for example, that in this Omicron wave, we have had a lower level of hospitalization and a much lower level of COVID deaths than the province of Quebec that went to a hard lockdown, including curfews, shutting schools and businesses, while we have kept virtually everything. In fact, I can't think of anything that hasn't been allowed to operate over the past several months, really since last spring. Yes, there have been some limitations, and yes, the proof of vaccination program has been an annoyance, but it has saved hundreds of lives and allowed us to keep all these businesses and organizations open and operating safely. So I make no apology for that. You know, people expect responsible leaders to make tough decisions. That's what we did in introducing the Restriction Exemption Program. And now we're making another tough decision that some people won't like, but I think it's the right one, which is to see that the program has outlived its useful purpose. I'll remind you, Rick, what I said to the very first question here, which is if today's announcement, if this is about domestic political considerations, then why is it effectively the same announcement made over the past month by England, Ireland, Scotland, Denmark, Norway, Finland, South Africa, Sweden, increasingly by US states, blue states, and now increasingly by Canadian provinces, including Quebec and Saskatchewan? I know it might be difficult for you, but maybe separate the politics out of this for once.
Thank you, Premier. Operator, can you please put through our second last caller?
Thank you, Tony Seskus, CBC.
Oh, yes, hi. Thanks for taking my question. I'm just wondering, someone had mentioned earlier in this news conference that hospitalizations were trending down. I'm just wondering if someone can flush that out and provide some hard numbers.
Sure. So we showed you that the admissions, the rate of new COVID-related hospitalizations has come down from about 36 per million to about 27 cases per million, and over the last, I think that process started on about January the 24th, and so we can get you more specific data on that. Of course, these admissions are a key leading indicator because this shows us what will be happening in the hospitals as current cases are resolved. You'll see the total numbers in hospital coming down. I should also point out that right now, as of 7:52 this morning, we had 5,346 non-ICU patients in our hospitals, and that is below the number that we have had very often at this time of year. For example, in 2018 and 2017, that number was higher in Alberta than it is now. We are currently at 87% of occupancy of non-ICU beds, which again is below where we normally are at this time of year. Normally it's north of 90%. With respect to ICU occupancy, we are now at total ICU patients of 198, which it is above our baseline capacity, but well below our current surge capacity. So we're at 82% of our available ICU, of our 173 available ICU beds that are currently occupied. There is real pressure on the system. We've been making that clear. That pressure is primarily coming from higher than average absenteeism due to COVID infections and self-isolation protocols. And of course, COVID patients do take up more space, again, because of isolation protocols in the hospital. So this is putting very real pressure on the system, not denying that. But we are seeing admissions come down, just as we are seeing the total active cases come down, the average daily new cases come down, the positivity rate come down, and on a province-wide basis, we're seeing the wastewater data trends come down as well.
And Tony, do you have a follow-up?
Yeah, I'm just wondering, Premier, if I could ask you, there's not much doubt there's been a pretty polarizing couple of years in a lot of the different respects in this province. I'm just wondering if I could get your thoughts on what it might take or what will happen to maybe, I don't know if the word is smooth that out, but how do we move forward from here?
Great question. And one of the things that concerns me most has been that division and that polarization. And so I would just urge Albertans, how about, everybody's got some grievances about policy, about the opinions of relatives, I know friendships that have been broken up over this. I know families where close relatives are not talking to one another anymore because of differences in COVID policy. I hear every day about physical altercations in stores and restaurants over things like masks and proof of vaccination. This is one of the tragedies of this terrible 2-year period. You can't really quantify it, but we all know it's real. I guess what's happening right now with these protests and the reaction to it is just an example of that. So I've tried to say all along that we need a lot of patience for one another. And I am concerned about this. I see some of the commentary from people who are opposed to lifting the Restriction Exemption Program. I've seen the following kind of comment a lot on social media lately. People saying, well, I don't want to go to a restaurant and have to sit next to somebody who's unvaccinated. That sentiment deeply concerns me. Treating fellow people as though they are somehow unclean. Listen, I've been amply clear that I think everybody should avail themselves of the protection of safe and effective vaccines, and that the choice not to get vaccinated is not just a personal choice. It does have social consequences, but it's never okay to treat people like that, to stigmatize people in that way. In a way, it kind of reminds me of the attitudes that circulated in North America in the mid-1980s about people with HIV/AIDS. That there's this notion that they had to be kind of distanced for health reasons. Listen, this is a terribly divisive attitude. So yes, we encourage people to get vaccinated, but treating people who have made a different decision as though they are unwelcome as members of our society is not acceptable. And on this, I would join the chair of the Quebec Liberal Caucus in calling on the Prime Minister to tone down some of the divisive rhetoric. One of the first and most important responsibilities of the Prime Minister is to be a uniter. Now, of course, we can't get past all of the differences of opinion and divisions on COVID policy, but surely the Prime Minister could find it in his heart to stop categorizing millions of people with terms like misogynist and racist. I think that's putting fuel on the fire of the social division, which we need to heal from and move on from.
Thank you, Premier. Operator, can you please put through our final caller?
Thank you. Mirna Vukic, Radio Canada.
Hi, thank you for taking my questions. Monsieur le Premier ministre, vous dites que votre plan de retour à la normale se base principalement sur la tendance dans les hôpitaux. Mais là, on voit qu'après une légère baisse dans le nombre d'hospitalisations dans la dernière semaine, on revient de remonter presque à ce que c'était le 1er février. Le nombre d'hospitalisations aux soins intensifs a aussi dans la dernière semaine. Alors, qu'est-ce que vous voyez exactement d'encourageant dans cette tendance et ce serait quoi la tendance dans les hôpitaux qui ferait sonner les sonnettes d'alarme pour vous, là?
Oui, nous voyons une diminution des nouveaux cas de COVID-19 de données dans le wastewater. Nous voyons une diminution de nombre des cas actifs total. Et également, nous voyons une diminution importante dans le nombre des nouvelles admissions des patients aux hôpitaux. Alors, toutes les tendances vont dans une bonne direction et nous sommes actuellement à 87% de capacité des lits aux hôpitaux dans les soins intensifs et dans les hôpitaux, dans les lits normaux. Alors, les tendances vont dans une bonne direction et notre système de prévision indique une continuation de ces tendances de diminution de pression sur les hôpitaux.
And Myrna, do you have a follow-up?
I do, thank you. Mais étant donné que vous parlez de tendance, mais vous n'avez donné aucun chiffre précis qui fait sonner les sonnettes d'alarme ou qui guide vos décisions. Quand on voit avec les manifestations qu'il y a eu à Coutts, avec les pressions qu'il y a à l'intérieur même de votre parti, à quel point ça joue dans vos décisions?
Écoutez, nous avons pris la décision formellement et finalement aujourd'hui, comme le comité du cabinet pour le COVID-19, basé sur les tendances et les données, nous avons vu les tendances semblables dans plusieurs pays et juridictions. C'est la raison pour laquelle l'Angleterre, l'Irlande, la Norvège, la Suède, le Danemark et plusieurs autres pays, l'Afrique du Sud, c'est la raison pour laquelle plusieurs États aux États-Unis ont décidé d'éliminer presque toutes leurs mesures de santé publique. Et je crois que c'est la raison pour laquelle le Québec et le Saskatchewan ont annoncé une approche semblable. Alors, je crois que nous voyons les tendances pareilles dans toutes ces juridictions. Mais quant aux politiques le programme des exemptions de restrictions, ça veut dire la preuve de vaccination. Là, le programme a marché. C'était un succès. Ça a résulté dans une augmentation importante dans le taux de vaccination. Et je crois que ça marchait quand les vaccins étaient plus efficaces en ce qui concerne les infections. Mais aujourd'hui, nous sommes effectivement gelés au taux de vaccination. Et évidemment, les vaccins sont moins efficaces en ce qui concerne l'infection. Alors, la situation a changé. Il faut changer de politique pour refléter la nouvelle réalité.
Thank you, everyone. That concludes our press conference.